So good morning to you all. Today we'll start with the bones of the head and neck. So first we have the cervical vertebra. So there are total 7 number of cervical vertebra. Out of this 7 number of cervical vertebra, we can divide it into typical and atypical vertebra. So atypical are your C1, that is your atlas, then C2, that is axis, and C7. C7 is also known as the transitional vertebra. From C3, C4, C5 and C6 we call it as typical because the features in all these vertebrae are the same. So in a typical cervical vertebra, there are some few structures which are common. Number 1, in the transverse process you will see a foramen which is known as the foramen transversarium. Number 2, in the spinous process you will see that the spinous process is short, the length is short, it is downturn and it is bifid. Okay? Bifid means it is split. Number 3, you will see that the body of a typical cervical vertebra is small and it is elongated transversely. And also the vertebral foramen in a cervical vertebra will be enlarged and it will be triangular to accommodate the cervical enlargement of the spinal cord. So you must be confused that why there are 7 number of cervical vertebrae and why there are 7 number of cervical nerves. So in order to clear the confusion, there is some relation between the cervical vertebra and cervical nerve. As there are 7 number of cervical vertebra and 8 number of cervical nerve, the first cervical nerve always passes above the corresponding vertebra. That is, the first cervical vertebra will pass just above. Okay, the first cervical nerve will pass just above the first cervical vertebra, that is in between the skull and the atlas. Okay, and it will be continuing. The 8th cervical nerve will pass just above the first thoracic vertebra. That is, first cervical nerve passes between the skull and the cervical vertebra and so on till C7. Then the 8th cervical nerve, it passes just above the first thoracic vertebra. So these are some few things which you need to remember while studying the entire cervical vertebra. Today in this class I will discuss only about the typical cervical vertebra, that is typical includes from C3 to C6. So let us see one cervical vertebra. So we will start with the typical cervical vertebra. So since the features of all the typical cervical vertebra, that is your C3, C4, C5 and C6, they are similar. So I am picking up just one cervical vertebra. So we will start with the body. So if you see the body, it is transversely elongated, it has a small body, it has an upper surface and a lower surface, and laterally it is upturned. So this upturned surface is known as the upturn process is known as the uncal process, UNCAL, uncal process. So this is the superior surface, this is the inferior surface, and this is the uncal process. So this articulates, say if this is C5, it articulates with C4 like this through secondary cartilaginous joint, and between the two vertebra there will be presence of your intervertebral discs. Okay? So here in the center you will have secondary cartilaginous joint, and between the uncal process and between the vertebra you will have the uncovertebral joint. Okay? So that is about the body. Next, coming towards the vertebral foramen. So if you see the vertebral foramen, it is somewhat enlarged and it is triangular. Why it is enlarged? It is enlarged in order to accommodate the cervical enlargement of the spinal cord. Okay? So here you will see the pedicle. Pedicle is directed backward and laterally from the middle of the body, okay, between the superior and the inferior surface, from the middle. So here we have the pedicle directed backward and laterally. Here also we will have the pedicle. Next we have the lamina here. The lamina is directed again backward and medially, and both the lamina meets at the spinous process here. The lamina of the corresponding, the lamina of the next vertebra here, they join with each other through a ligament known as ligamentum flava, F-L-A-V-A. So the lamina will be joined with each other through a ligament known as ligamentum flava. Here in the body, I forgot to tell you about one thing. The anterior surfaces of the vertebrae, you have anterior surface of the body, you have posterior surface of the body. So the anterior surfaces, they are joined together by the anterior longitudinal ligament. The posterior surface, they are joined and they are covered by the posterior longitudinal ligament. So the anterior and the posterior surfaces of the body are covered and joined with each other by anterior longitudinal ligament and by the posterior longitudinal ligament. So now we are done with the body and we are done with the vertebral foramen. Next, coming to the superior and inferior articular facet. So if you see at the junction of the pedicle, this is the pedicle and this is the lamina. At this junction you will find the superior and inferior articular facet. This superior articular facet is directed backward and somewhat upward. As you can see here, it is directed backward and somewhat upward. This is the inferior articular facet. This inferior articular facet is facing forward and it is facing inferiorly. So I repeat again, the superior articular facet is facing backward and upward. The inferior articular facet is facing forward and inferiorly. So the surfaces, the superior articular facet and inferior articular facet, they are somewhat flattened and they form a joint known as the plane synovial joint. So the movements which are taking place at the superior and inferior articular facet are flexion, extension and restricted rotation. So I repeat again, the superior articular facet, inferior articular facet. So the joints which are formed here are, so if you see, the superior articular facet articulates with the inferior articular facet. So a plane type of synovial joint is formed between the superior and inferior articular facet. Flexion, the movements which are taking place are flexion, extension and restricted rotation. Next, so we have seen the body, we have seen the vertebral foramen. In vertebral foramen, we had seen the pedicle, we had seen the lamina. Okay, we had seen the superior and inferior articular facet, we had seen the joints formed by the superior inferior articular facet. Next, coming to the foramen transversarium. So the presence of foramen transversarium is the only is how you identify and distinguish the other vertebra from a cervical, the cervical vertebra from the other vertebra. So if you see here, this is the foramen transversarium. The foramen transversarium transmits the vertebral artery. The vertebral artery has got 4 parts. So the second part of the vertebral artery will be present here. It transmits the second part of the vertebral artery. This one here we call it as the anterior root. Okay, this comes from the body. So this is known as the anterior root. This is the anterior tubercle. So we have the boundary of the foramen transversarium is formed from anterior to posterior by the anterior root, anterior tubercle. Then you have the costotransverse bar here, then the posterior tubercle and the posterior root here. Okay, and this is known as the notch, the vertebral notch. So I repeat again, from anterior to posterior, this is the anterior root, anterior tubercle, costotransverse bar, this is the posterior tubercle and this is the posterior root, and this is the vertebral notch. So the anterior root, the anterior tubercle, the costotransverse bar and the posterior tubercle, they are purely costal element. They represent the costal element. I repeat again, the anterior root, anterior tubercle, costotransverse bar and your posterior tubercle, they represent the costal element, because if you see here, all of them lie in front of the vertebral notch. Only the posterior root here, the posterior root or posterior pillar, it lies behind the vertebral notch. So it represents the transverse element. So here we have in the foramen transverse area, we have two elements. One is the costal element and one is the transverse element. So all the other are the costal element except your posterior root, because it lies behind the vertebral notch. So the vertebral notch here, it is related to the corresponding cervical vertebra. Say I had picked up C5, that is the fifth cervical vertebra. So this part of vertebral notch here will be related to the root of C5. Then it is divided into ventral root and a dorsal root. The ventral root will pass laterally and above the notch, which is just above the costotransverse bar. Here the ventral rami will be passing, and the dorsal rami turns backward, and between the superior articular facet and inferior articular facet, you can see a concavity here. You can see a concavity here. So at this concavity, the dorsal rami of the cervical vertebra will pass. So I repeat again, this vertebral notch is related to the corresponding cervical nerve. The ventral, it divides into ventral rami and a dorsal rami. The ventral rami passes through the notch above the costotransverse bar, and the dorsal rami passes at the concavity, which is lying somewhere here in between the superior and inferior articular facet. So I hope it is clear to you all. So lastly, we will see about the spinous process. The spinous process here in a cervical vertebra is like short and it is downturn. Okay, it is bifid, means it is split. So at this spinous process, a ligament known as ligamentum nuchae and some of the muscles of the back are attached here. So regarding the anterior tubercle, few muscles are attached here at the anterior tubercle, that is your longus colli, longus capitis and scalenus anterior muscle. Three muscles are attached here at the anterior tubercle. At the posterior tubercle, again we can name three muscles, three important muscles, that is your scalenus medius, scalenus posterior and your levator scapulae. So I repeat the attachment again. Here in the anterior surface of the body, you have the attachment of the anterior longitudinal ligament. Posterior surface of the body, the attachment of the posterior longitudinal ligament. At the anterior tubercle, you have the longus colli, longus capitis and your scalenus anterior. At the posterior tubercle, you have scalenus medius, scalenus posterior and levator scapulae. Here at the lamina, you have the attachment of the ligamentum flava. Here at the spinous process, you have the attachment of the ligamentum nuchae. So if you are given a cervical vertebra in your exam, how do you hold the bone in anatomical position? Okay, so what we do is we have to first identify the foramen transverse area. We need to see the size and shape of the body. We need to see the spinous process. So once we had identified all this, we have to again differentiate whether it is a typical or atypical. So once we find it as a typical cervical vertebra, we have to hold the bone in such a way that the body is directed in front, the transverse process, the foramen transverse area, they are lying laterally, the spinous process directed backward and downward. So this is how we hold a cervical vertebra in anatomical position, and all the description and everything should be done according to the anatomical position of the vertebra. So if you see the other vertebra also, it is just the same. You can see this is C3, the foramen transversarium here, this is the uncal process, then pedicle, lamina, bifid spinous process, superior articular process, inferior articular process. So same thing here. So next class we will see about the atypical cervical vertebra. In atypical cervical vertebra we will see about the first cervical vertebra, that is the atlas, then second axis, and seventh vertebra, that is your we call it as the vertebra prominence. Okay. So that's all for today. Thank you.